Mr. Davies, 65-year-old male history. Peptic ulcer disease, non-compliant with PPIs. Chronic NSAID use. Ibuprofen 800 milligrams TID for back pain. Type 2 DM on metformin. Presentation. Sudden, severe abdominal pain, like I'm being stabbed. Vitals. HR 122, BP 98 60 seconds, RR 28, temp 38.1 degrees Celsius, 100.6 degrees Fahrenheit, SpO2 94%, RA physical. Abdomen. Rigid, board-like, rebound tenderness. Bowel sounds absent. Rectal exam. Guaiac negative. Subdiaphoretic free air sickle shape radiolucency on both sides. It's easier to identify on the right side than the left. Indicate diagnosis. Pneumoperitoneum, suspected perforated ulcer. The X-ray finding most diagnostic for pneumoperitoneum is A. Air fluid levels. B. Sickle-shaped air under diaphragm. C. Thickened bowel walls. D. Dilated stomach bubble. Answer B. Sickle-shaped subdiaphragmatic air is pathognomonic for pneumoperitoneum. Why is free air easier to see under the right diaphragm? A. Liver provides a dense background contrast. B. Left diaphragm is thicker. C. Gastric bubble obscures the left side. D. Patient positioning. Answer A. Liver's density contrasts sharply with air, left side obscured by gastric bubble. Immediate nursing action before surgery. A. Administer 4-pantoprazole. B. Insert NG tube to low intermittent suction. C. Start metformin. D. Place in Trendelenburg position. Answer B. Edgy decompression reduces further contamination and prevents vomiting/aspiration. The surgeon orders CT abdomen with IV contrast. Which medication must be held? A. Pantoprazole. B. Metformin. C. Ibuprofen. D. Acetaminophen. Answer B. Metformin use with IV contrast increase lactic acidosis risk. It should be held 48 hours pre/post. Pre-op vital signs. BP 90/50ths, HR 134. Priority intervention is A. Administer IV morphine. B. Bolus 1 LLR IV wide open. C. Obtain ECGD. Apply warm blankets. Answer B. Hypotension with tachycardia suggests hypovolemic shock. The nursing priority should be recognized to do fluid resuscitation first. Post-op day 1. The patient develops tachypnea, RR 36, and SpO2 88%. This suggests A. Atelectasis. B. Anastomotic leak. C. Hypoglycemia. D. Pain. Answer A. Atelectasis is the most common pulmonary complication in the immediate postoperative period, first 24 to 48 hours. It results from shallow breathing due to anesthesia, splinting from pain, or recumbency, leading to poor ventilation of the basal lung segments. Which finding indicates return of bowel function? A. Absent bowel sounds. B. Passing flatus. C. Abdominal distension. D. Nausea. Answer B. Flatus confirms bowel motility return, which allows diet advancement. Patient asks why he can't restart ibuprofen. Your best response. A. It causes kidney damage. B. It can cause another ulcer perforation. C. It increases bleeding risk. D. It worsens diabetes. Answer B. Buprofen inhibits cyclooxygenase, COX-1 and COX-2. COX-1 inhibition is particularly problematic for the gastric mucosa because it reduces the production of prostaglandins, which are responsible for protecting the stomach lining by promoting mucus and bicarbonate secretion and maintaining mucosal blood flow. In a patient who has just had surgery for a perforated ulcer, the stomach lining is raw, healing, and extremely vulnerable. Restarting an NSAID immediately post-op would strip away the protective barrier, significantly increasing the risk of the newly repaired site breaking down or a new ulcer forming and perforating. While NSAIDs do carry risks of kidney injury and bleeding, in the context of a patient who has just undergone surgery for an ulcer perforation, the most direct, life-threatening, and procedure-specific risk is reperforation. If free air reappears on post-op X-ray, the nurse anticipates A. Increased oral fluids. B. Emergency re-exploration surgery. C. For antibiotics, only. D. Discharge delay. Answer B. Recurrent free air indicates failed repair and emergent surgery is indicated. Mnemonic. Perforate for pneumoperitoneum management. Position: upright for X-ray, evaluate for sepsis, lactate, WBC, resuscitate with IV fluids, free air, confirmed, do NPO/NG tube operation, consult stat, remove harmful meds, NSAIDs, metformin, antibiotics. Cover anaerobes, time critical, surgery within 6H, educate on ulcer prevention, PPIs, no NSAIDs. Pneumoperitoneum can't miss, X-ray signs. Finding: clinical meaning. Sickle under diaphragm, crescent-shaped licency, air, between the diaphragm and liver, right, or stomach, left. Highly specific. Wriggler sign, visualizing air outlining both the inner mucosal surface and the outer serosal surface of the bowel wall. Football sign, massive amount of free intraperitoneal air outlining the entire abdominopelvic cavity, making it appear large and oval, like an American football. The falciform ligament may be visible.